I got my first dose of the vaccine on December 26th. It was a very easy experience to do, and the next day I had a little soreness in my deltoid that I could barely raise my arm, but after that it's been a wonderful thing. So I haven't had any problems since having the vaccine, and I look forward to having my second one the end of this month. I ended up getting the Moderna vaccine. That one was much more easily available, I believe. And all the healthcare systems here in my area, I think, pretty much has the Moderna vaccine. So the hospitals are rolling out the vaccines for their clinical staff and for physicians, and particularly those who are working on the COVID unit or working directly with COVID patients. But certainly the vaccine is available for other physicians as well. I did sign up to receive the COVID vaccine with my hospital system, and I have yet to be called to have that done. So I took things on my own and went and got a vaccine through the Dayton Public Health, because they're offering the vaccinations for those who are in the medical field. And as it turns out, which is a great thing, because I think that everyone needs to be involved with getting the public and everyone who wants to have the vaccine to make sure that they can have that done. I received a text message from a group that I'm involved with, and it gave instructions on where you can go and get a vaccination. It was at the Dayton Convention Center. It was a very nice setup, and I went there. I took some of my clinical staff with me as well, and we all received the vaccine. And luckily, I shared that link with other physicians who may not have been affiliated with a hospital system, and they too were able to get the vaccine and have their staff vaccinated as well. It was a very easy process to go down to the convention center. It was very well orchestrated, very well organized. They took your information. If you had any previous severe allergies to anything, they wanted to know all of that history, because after receiving the vaccination, then you would be observed for a period of time. For me, I didn't have any risk of previous allergies, and so I did have to wait for 15 minutes. However, there were staff with me that did have previous allergies, and their wait was 30 minutes after, and it was just to wait and make sure that I did not have any side effects to having a vaccine. So I was not worried at all about getting the vaccine. I just understand what vaccines do to you and what they do in your body. This vaccine is a messenger RNA vaccine, and it's not a live virus. You know, some vaccinations are live viruses, so it's like you're getting a little bit of that virus. But in this case, it's just turning your immune system on so that you can respond appropriately if you were infected with SARS-CoV-19. So all of my colleagues are not gung-ho about getting the vaccine. There are some reservations, just as with patients that I share. Physicians are human as well. And some would say like, hey, I've probably already been exposed to it, although not sick that they end up in a hospital, possibly have a little scratchy sore throat or whatever. A lot of people think that way and think like, oh, I've already had it. So I have had some physicians just to check for their antibodies to see if they had been exposed to it and just asymptomatic from it. And we found some that were. But for the most part, physicians are wanting to get this done and believing that how we're going to decrease or get over this pandemic is by everyone getting vaccinated, maintaining the social distancing and the frequent hand washing that we've already been taught to do. It is concerning that it's been a slow process. We anticipated to have way more people vaccinated at this point, and it's very concerning. I don't know where the glitch is or what's the bottleneck in this process. Maybe it's just being prepared to handle such a heavy load. I'm hoping that with the new administration that there's going to be involvement possibly in the National Guards, and so that we can get this vaccine disseminated to a wider range and get people vaccinated. So if you're still nervous about getting the vaccine, and quite honestly, I've been questioning my patients as they come in and asking if they're going to get it. And it's been a very diverse range of the reasons why people will or will not have the vaccine. I had one patient who said that she was afraid that the needle was too long. So luckily, I had a video of when I went and had the vaccine done myself, and I shared that with her, and she thought, oh, okay. what I saw on the internet was not correct. This needle isn't that long. I'm going to go ahead and get it. And so we actually wrote our name down because I too will be delivering the vaccine to patients once it's rolled out to physicians' offices. I did sign up for that. I think as a whole, it's a great idea for everyone to get this vaccine. I know we all have rights and what we put in our bodies, but if you truly understand what it does, and that understanding comes from knowing what that vaccine will do in your body, and what it does, it gets your immune system prepared to fight an antigen that may be invading in your body. And to break that down and make it a little bit more simple, when you're exposed to something, if it's the first time you're exposed to it, your immune system will respond normally the way it's supposed to and line up that defense. We have something called natural killer cells. We actually have those. And it's just getting the sequence together. Versus if you don't have the vaccine, then it's a new exposure to your body. And what happens is there's kind of like chaos. It's called a cytokine storm. And that's just chaos. Like, what do we do? What do we do? And then as a result, it creates a more inflammatory state in your body. And the sequelae of that is COVID-19 disease. Yeah, I wish I knew when we were going to receive that. I was very excited when I got an email like, hey, would you like to sign your office up for it? So I did immediately. And every day I'm looking to see like when I can anticipate the arrival of the vaccine to the office. I don't have it. And so that's why we are just taking down names, and so that as soon as it comes in, to inform our patients that we do have it. I think it's going to take an effort on all healthcare workers, hospitals, drugstores to really get this out. And I think it will be great. I'm hoping to eventually be done with this pandemic. I have big plans at the end of this year, and that may not happen the way I would like for it to happen if we're still in the middle of this pandemic. I think it's important that we still adhere to the guidelines that we have, whether or not you're having the vaccine done or not. I think it's also important to make sure that your baseline, that your health is good. That's where supplements come in. It really does play a factor. These comorbid conditions that we've heard about, and why some patients, react differently if they're exposed to the virus, and some end up in the unit on a ventilator, and others, they're asymptomatic from it. So it's the baseline, your immune system, it's your baseline immunity. And what helps to improve that is the food we take in, supplements that we take, low stress, making sure that we're getting adequate sleep. These are things that are important for a healthy immune system.